Our next speaker today, Sri S.S. Naganand, Trustee of Sri Sathya Sai Central Trust and Senior Advocate of both Supreme Court and High Court of Karnataka. Sri Naganand has been serving in Bhagwan's healthcare mission for many decades. I request Naganand sir to address us.
Om Sri Sai Ram. Om Namah Pranavarthaya Shuddha Brahmaika Murtaye Nirmalaya Prashantaya Dakshinamurtaye Namaha. Gurur Brahma, Gurur Vishnu, Guru Devo Maheshwaraha, Guru Sakshat Parabrahma, Tasmai Sri Gurave Namaha. Most revered Bhagwan, professionals from the medical fraternity from all over the world, my fellow trustees, devotees of Bhagwan who have assembled here, and the multitudes who are watching this program live across the world through Radio Sai and Sai Media Center. I bring you hearty greetings on this lovely Saturday morning. The sun is shining, the clouds are hovering around, so Puttaparthi is not as hot as it normally is. So those of you who are wearing jackets will be a little uncomfortable in this weather, but I assure you that if you come in your jackets in summer, they'll get wet in about 25 seconds if you sit in this hall. I've been asked to say a few words. I'm in a dilemma. The same dilemma I expressed to Bhagwan in 1999, when one day Bhagwan invited me for an interview, and at that time he invited me consecutively for several days, and it was his grace and blessing in Vrindavan, Whitefield. On the last or the third day, he said, I have an assignment for you. So I was waiting to listen, and Bhagwan said, I want you to be a trustee in the Sri Sathya Sai Medical Trust. In those days, Swami had set up two trusts. One was the Sathya Sai Central Trust, which is situated here in Puttaparthi, and that's the apex trust, if we can call that. And there was a medical trust to do medical relief work, and that was the one which was running the hospitals. So when Bhagwan said this to me, I was a bit taken aback and shocked, because I'm not a doctor, I belong to a legal profession, and except for my devotion to Bhagwan because of my father and our family, I had no other connection to medical world except to go to a doctor when I had some trouble. Otherwise, there was no other reason for me to be in the medical fraternity. So I looked very blank and said, Swami, I'm not a doctor, very sheepishly, as though he didn't know. But then he smiled and said, no, you must be there in the trust. There were only 3 trustees at the time, and I'm going to be one of them. So I said, Swami, I don't know anything about medical profession, so I'm not sure what I will do there. So then he said, you don't worry, you just be there, and I will do everything. So I touched his feet tightly, held it tightly, and said, Swami, if you say that, then your wish is my command. I'll do anything that you want me to do. And that's how I got inducted as a trustee of the Sri Sathya Sai Medical Trust. And that was a time just before the building of the Whitefield Hospital, as Dr. Sundaresh just now mentioned, in 2001 that was built. So this exhilarating exchange took place about a year before that. And after that, there was not much work that Swami gave me. There were no meetings of trustees like we have, no minutes of meeting, no agenda, nothing. There was only one agenda, and that is to come for Swami's darshan whenever possible. That was the only agenda. The greatest thing that you must understand is, when Swami said, I will run it, you don't have to do anything, it was not just some sympathetic words that he uttered. He meant every word. Those are the doctors who served during Swami's time will remember, every day Swami used to first talk to the doctors, then talk to the university vice chancellor. When he came for darshan, from there, you would come straight to the veranda and look at who the doctors there. And any problem in the hospital, anything that was needed in the hospital, Swami would look at the desire in the eyes of the director and said, come, let us discuss. He knew exactly what was the problem that was there on that moment. So Swami used to call them, talk to them. Sometimes he would hear them in the veranda and dispose it off. Otherwise, this was the standard practice. If it was little longer discussion, then afternoon darshan when Swami came, the first person to be called in would be the medical doctors or the university, and only thereafter others who had anything to place before Bhagwan in the organization aspect he was calling. Every single rupee that was spent in the hospital was spent under the direct signature of Bhagwan. I mean, many people ask me, so many institutions, how was Bhagwan running it? He was the sole trustee of Central Trust. There was a fantastic mechanism that was laid down. Every single rupee had to go under Swami's signature on a check to draw the money to the hospitals. And these checks were not issued just like how we nowadays do in corporate world. Somebody sends up a check, you sign it and just close your eyes and go. It was not like that. The budget, the previous month's expenditure, and the two finance heads of the hospitals had to be there and explain to Bhagwan what was last month, what is this month, how many doctors are there last month, how many are there this month, how many staff are there, how many left, how many have joined, why we are spending more on medicines, why we are spending less on something else, how much electricity is being consumed. All of this would be summarized before Bhagwan. Only if he is satisfied, then he will authorize, sign the check himself, the money would get transferred and the hospitals would run. This is on the financial side. But on the medical side, I've heard stories of many doctors telling us that when they were in great difficulty, they were not sure what is to happen, he used to help them and guide them in medical world. I remember many years ago, I visited one of Swami's hospitals in Rajkot. It was another trust which owned it. And I met a senior doctor there, Srimati Varshaben Shah. She was the head of the department in the government hospital in Ahmedabad, but she was coming here for heart surgeries. And I asked her, why do you come here? She said, see, I don't know anything. I've never had Swami's darshan. But I come to the operation theatre. There's a Swami photo outside. The minute I see that photo, whatever problems are there in the surgery are just resolved. She says, many times I'm actually operating and I say, oh God, this is a problem. What do I do now? And suddenly a solution comes up. She says, this has never happened to me in any hospital where I've worked, and this is the only place it happens. A few months after my meeting her, for the first time there was a medical conference like this, she came here. And she was seated here in the audience. So nobody told Swami anything about her. And Swami came for darshan, and this is what I saw. He came, stopped by her, looked at her, and talked to her, and said, you're a devoted doctor. If you have devotion, all the problems of the patients you can solve. This is what Swami told her. And later on, she recounted this interaction. She says, first time I'm coming for Swami's darshan. I've never seen him before. But on the very first occasion he came, he knew everything about her and guided her. So what I'm saying is, this is Swami's style of functioning. Now we look at it and say, why should all this be done? Swami always said that we should help others, help ever, hurt never. Now, why is it that we should do this? In Acharya, Shankaracharya, in one of his works, he asks a question. He says, Kim manusheshu ishtataram, means what is it that is liked by everybody? And the answer he gives is, Swa parahitaya udyatamam janma, means you are leading a life for yourself and for the welfare of others. So Swami always said that we should help others. Swami never said, come and help me. He never told the Sevadal that you have to come here and look after this ashram, keep it clean, look after devotees. This is not what he said at all. He said, if you want to redeem yourself, you must help other people. So all these institutions are with the object of helping others. I'm very happy that Dr. Sundaresh mentioned about this appointment system. I very distinctly remember, just after the inauguration of the Bangalore hospital, the super specialty hospital on January 29, 2001, next day Bhagwan had a meeting of it was called a board of management, And those meetings were held sometimes in Bhagwan's presence. So that first meeting was held in Whitefield Hospital in Bhagwan's presence. He sat in the main chair and all of us were sitting. I was the youngest member in that group, so I was the last to sit on the right side. Everybody else started from the left. So the meeting started, then Swami asked, what do you want to do in this hospital? Like this, one by one, several doctors were there. He went on asking all of them. And finally, my turn came. He looked at me, and whatever, had to be said has already been said by the doctors. So he asked me, New Chappu. Then I said, Swami, to my mind, this should be a hospital where any patient who comes here, he or she will be seen on that day, and some advice will be given, treatment will be given, if possible. Otherwise, the patient should know the position, what they are in. So I said, yes, this is how it should be. But it has taken us so many years now to achieve this, thanks largely to a very great initiative taken by the alumni of the university and other volunteers who have set up now a communication system by which you just call a number. Any patient calls the number and he asks for a time and a date and the specialty. They are given then and there, they're given a number and they can come on that day. And as doctor mentioned now, every patient who has an appointment who comes there is seen on that very day and is told what the problem is, what can be done, what cannot be done. So this is an amazing achievement to be done in a free hospital, because earlier we were discussing about where to put shelters for the people who come. They start lining up at 4 o'clock in the morning. It's cold in Bangalore. Make a shelter for them. All these problems are there. And how do you maintain a list, waiting list and other things? Everything got resolved by this methodology that has been done, all because of keeping in mind what Swami said. Now Swami always used to say, Paropakaraya punyaya, papaya parapedanam. That means when you help others, that is punya, or you're earning merit. But if you trouble somebody else, that is demerit, and that's going to sin, it is going to haunt you. One more answer which Acharya gives is he asks in the same Prashnottara, he says, Kim Satyam, what is truth? And to that he answers, Bhuta Hitam. That means, do something which is good for all living beings. If you do something which is good for all livings, that is Satyam, that is the truth, that is what you should live for, that is how you should read your life. So if you look at these institutions, what are they doing? What are the doctors doing? They are looking at patients as people who deserve treatment, who are in trouble, who are in pain, who have to be relieved, both physically and mentally. And that's exactly what the doctors are doing. One more sloka I remember, which again is from Acharya. It says, Avinaya Mapanaya Vishnu, Damaya Manaha, Shamaya Vishaya Mruga Trishna, Bhutadaya Vistaraya Taraya, Samsara Sagarataya. Means one prayer is Bhutadaya Vistaraya. I have some love for compassion for others. Prayer is, please keep on expanding this love. Expand this love. I want this love to be expansive. And Swami often said, expansion is life. And that is how it should be. So Swami started, as we rightly heard now, sometime in the early 50s, a small medical facility in Puttaparthi, which was, as I said, one doctor treatment center. And it has now expanded to practically all over India now. We have such hospitals in different parts of India, which renders that, though not run by the Central Trust. Now, across the world, we have doctors who come here during the festival seasons and run medical camps here. In my recent visit to America, I visited many places and I heard about number of medical camps that are being held in different parts of the world. And so the doctors and others who are living in different parts of the world, they are running these facilities in different centers, high centers all over the world, all guided and inspired and blessed by Bhagwan. If you cannot think of another institution which is doing this, it's inconceivable. Now, as doctor mentioned, to expand is, Swami always used to say, if you want to give prasadam to a villager, don't ask him or her to come 5 miles to Puttaparthi and then ask him to wait here and give him prasadam. You should go to his doorstep. I remember many times I went along with the boys during the time that Navaratri time when they go. They would go to each house, go to the door, ask how many people are there, give them the prasadam, tell them Sai Ram, and then come. So in other words, you must go to the doorstep of the needy, was Swami's advice. So keeping view of that, we now have mobile hospitals, not only in Puttaparthi, they are in other parts of the country also. In Delhi we have one, Madras we have one. Many other places have started this. So it is and the quality of care that is being given in the mobile hospitals is increasing. We are expanding, and we have got more modern facilities now in the mobile hospitals, which treats many ailments that are commonly there in these places. So the ultimate end is that we should do whatever we can to help everybody in the world and keep everybody happy, as we say, Sarve Jana Sukhino Bhavantu. I only like to end with a quotation from what Bhagavan said, and I quote, "The flower of compassion to all living beings is Sarva Bhuta Daya Pushpam." It's very dear to God. From the seed of divinity grows the tree of creation. In this tree, the fruits are human beings who are Jivatmas. In each of these fruits, divinity is present as a seed. In Bhagavad Gita, Lord Krishna said, "Bijam mam sarva bhutanam." I am the seed in all living beings in the form of Atma, the soul. Recognizing the truth that God is present in the form of Atma in all living beings, being compassionate to all is what God expects from you every day. God loves the flower of forbearance, Kshama, very much. It is truly the highest quality of a human being. Often you develop narrow ideas, thinking of I, my family, and treat others as different from me, when you should not be doing anything like this. Now, an unquote. Now, if you look at this quotation from Bhagavan, it becomes very clear that this was the message that he gave to the medical fraternity and to all his devotees. So that is why we have Sevadal who come here from different walks of life. Some of them are students, some of them are working, some are teachers, some of them could be professionals. They just shed their natural aura, and they come here and they don a scarf and they are ready to do any task that is given to them. Nothing is menial for them. Everything is seva. Everything is seva to God. And we are so happy to see so many doctors from all over the world. They say, I'm going to take a 15-day break. I'm going to spend 1 week in that break in this hospital because I want to be of some service to the poor and needy which this hospital is serving. It is not that we invite them to say, we don't have doctors, so please come here. We have doctors, we have everything in the hospital. In fact, we have to slot them as to say, in this time, it's possible for us to accommodate you. I mean, this is the kind of demand that is there. I think this medical mission, as I said, has no parallel, and it is something which is unique, and many international associations, organizations have realized and recognized this. And we must only thank Bhagavan for giving us all an opportunity to be part of this mission, to do whatever little seva we can do, and to ensure that this mission continues in this glory and in better times that come in the future. We pray to Bhagavan to help us achieve this and for your blessings to all the people who are participating in this health mission, especially today and the next 2 days when you're going to have a wonderful conference. I had a look at the conference topics, and I must say that more than 50% of it went above my head. But I'm going to attend a few sessions, and I look forward to illuminating discussion among the doctors with the object of improving their knowledge and improving the state of healthcare that is being provided in Swami's institutions. Welcome to Puttaparthi. Wish you all a very happy and a pleasant stay and a safe return to your native. Thank you. Jai Sai Ram.